Hi everyone, Dr. Dale Miles here in Fountain Hills, Arizona, in my office, my study, where I do all my reporting. I get scans sent to me by clients, dentists and dental specialists, and I actually look at the data and do a formal report. And what I'd like to do for you today is show you something you can use, a very simple software that's both a report software but also a decision support software. It has some features in it that help you examine your volume without missing something important. So I'm going to open up EasyRiter. You'll see the image come up here on the screen. That's our splash screen, and hopefully you can see the entire screen at this point. There we go. Okay, so I'm going to keep my little picture here on the screen a little bit, but what I want you to see is that EasyRiter has a structured sort of format. When I report cases, when any radiologist reports cases, they look at all the volume data and they look in anatomic regions. And the anatomic regions that I constantly report on are the paranasal sinuses, the nasal cavity, the airway, the cervical spine and other osseous structures, of course the temporomandibular joints, a few dental findings. We don't want to rechart your patient for you. You've already got a lot of the information. So things like missing teeth, impacted teeth, tori and exostoses, periodontally involved teeth, we just make some generic statements, and endodontically involved teeth. The important part for you to kind of comprehend is that there are other findings that we see on a pretty routine basis. If there aren't any, we can click a box and it'll populate that statement. But carotid plaques, which you've found on your panoramics, show up just as well or even better on cone beam CT data. And they show up in places other than the internal carotid in the cervical component, in the neck. The paracellar region up by the sphenoid sinus, if any of you capture volumes large enough to do the temporomandibular joints, even sectional TMJ fields of view, you're going to see portions of the internal carotid artery segments, and there's 4 or 5 of them up in the sella turcica region, or the pituitary sphenoid region. And I'm going to show you why those are important. There are some statements related to that, and we'll show you these as what we call pop-ups to help you decide whether or not that's the important finding that you need to refer. If you need to refer, then of course there are recommendations, and you can see that in the recommendations there's only maybe 10 or 11 statements. We may add 1 or 2 as we go along. I've been finding it necessary to refer to other specialty people, especially in medicine. And for instance, we added more recently, the patient should be referred to their primary care provider and or an otolaryngologist for evaluation of mastoiditis and suspected otitis media. Mastoiditis and otitis media go hand in hand frequently, and the patient's symptoms plus your cone beam scan will lead you to the right referral. But what I want to do first of all is go and show you the simple setup. You have to populate, the information on the left column here, and that is you have to start by setting up your own company. When you're adding your company, or when you first open this up, you'll see this, your company name here. It's a blue highlighted statement. If you double click on it, you can put in my implant practice or whatever it is. And basically, if you have a practice name, you can stick that in that area. Over to the right, you would put your name. We're going to make you Dr. Smith today. And the description, cosmetic and implant dentistry. You will type faster than I do, so and I'll probably make some mistakes along the way, like I just did dentistry. I can't spell. All right, so your address, you would put your address in there. I'm going to put you on Elm Street today. Phone number, I'm not going to put one in here. A logo, if you have a practice logo, you can click on the little box to the right, and these are all instructions that you get or download with a manual with the program. But if you had a logo, you know, a picture that you wanted to put in there, you could actually find it in your, you know, on your computer and just say enter it. So let me see if I've got one here. I think I have one for Cone Beam Radiographic Services. CBRS. There we go. I don't know if I've got my logo in here. Probably not. I got my signature though. I'll show you that in a second. So if I had a logo, I would click on that, find it, and pop it in. For my signature, I've just looked at it again, just showed you where it was. So I have it stored under my practice name at the bottom of the list here. And if I put Miles' signature, you can see it pops up as the file name. And you can select whatever format you want. When you put it in, it has this, it'll prompt you whether the signature is too large or too small. Mostly too large because it has a restriction in size. If you plan to refer to or have doctors refer to you, if you have a cone beam machine and you've got a friend down the hall or colleague that wants to send you scans or patients for scans, you can click on the little plus sign here and in it fill in, we'll make it Jones, Dr. Jones. We won't give him an initial, but Dr. Jones, phone number, we'll give him a fictitious one. And when you say confirm, you'll see Dr. Jones pops up here. It's very important that once you've completed this, you want to hit the confirm button because that's how it stores. So if we go back to the company name, the findings are over here. We'll get to that in a second. If we refresh that or reset it, you'll look and you'll see that when I do the drag down box for company name, yours is in there, my implant practice. Dr. Jones is referring to you. This phone number pops up. The patient, my favorite patient, Ms. Ida. No, I don't know nothing. That's my favorite patient. She's a female, of course. Hope you're laughing out there. We're going to make her 65 today, hopefully with no COVID-19. Just kidding. The reason for the scan, implant assessment, or whatever you want to put in. And the field of view, this was actually for my Canadian colleagues in one of the provinces and maybe to be adopted in others. They have to list a whole bunch of things in the report, and it's mandated that they do a formal report like this. So we're going to put in an 8x8, which is a popular view. So 8 by 8, and we'll put centimeters as the unit. So once we've got this populated on the left, we can create a report, but we don't create the report without examining the scan, and that's the beauty of it. You have to examine the scan. So let's say you had captured screenshots from your Cone Beam software program. You could bring them up on the screen, or you could use this software to populate it as you went scrolling through your volume. And in the components that I put up, the 5 or 6 webinars, seminars on drconebeam.com, we actually will show you or walk you through how to examine a report. But for purposes of using this software, we're going to assume that you've got some images, and we're just going to make up some statements to show you how easily the actual report populates. So it defaults to the maxillary sinus, and you can see there's a whole bunch of findings in the maxillary sinus, but I've divided them up sort of statements of left and right. And if there's something that you're not sure of, you see a opacity within the sinus, a density that you don't know what it is and you've forgotten what to call it, you'll see a hyperlink for the things that Dr. Danforth and I determined that you may not be familiar with when you first start looking at Cone Beam. So, and some of you out there that have been looking at Cone Beam have probably missed some of these things, but let's take the term antrolith. You can see the hyperlink, my cursor's over it. If I click on that, an example of an antrolith will pop up here, and what it'll say is it'll give a description. An antrolith is a calcified mass in the maxillary sinus. The origin of the nidus of the calcification may be extrinsic, meaning outside the sinus, or intrinsic. A lot of times, and I'm going to show you a fungal case in the seminars that I do. But if you see it and you say, yeah, that's what it is, that blue, and they don't, this is, your examples come with the arrows. You have to put the arrows on if it's your own case. But you can see that there's cloudiness of the left maxillary sinus. There's a foreign body in it. In this particular case, that foreign body actually came through an AO defect here where my cursor is showing you. And basically, you convince yourself, yeah, you know what, that's an antrolith. So, and it was in the patient's left sinus. So when you click the statement, it'll pop up and populate in the dialog box below. Certain statements you'll want to highlight. Maybe not an antrolith, no one's going to die of an antrolith, but if you found a carotid plaque, you would click this highlight button over here, and on the highlighted, or on the report rather, it would come out with a yellow highlighter on it. So let's say that we saw an antrolith there, the other sinus was fine, the right maxillary sinus. When we looked at the ethmoid air cells, and we haven't looked at a case, but I'll show you how it populates. Let's say one or two of those air cells are opacified. The sphenoid sinus, maybe there's no significant finding. The frontal sinuses, let's say that there's a lesion, okay, and sometimes you'll get a statement that says as described. So when I click on that, you'll see that's the last statement in the bottom box. When I double click on that, I can add the description. So there's a lesion in the right frontal sinus described as a mixed radiolucent / radiopaic lesion opacity, we'll call it. And let's say you think that it's consistent with a frontal sinus osteoma. Can't spell again there. You could say that. Osteoma. So once you've described that, it'll stay in the report for you. All right, so mastoid air cells will say that there's no opacification. You scroll through your volume, you see the area, the nasal cavity. Maybe there's a deviation, okay? Maybe it's deviated to the right. Very common to have a septal deviation. The turbinates, there are three, inferior, middle, and superior. We rarely see the superior, but the middle turbinates often have an anomaly in them. It's a pneumatized area called concha bullosa. There's even a classification for that in the ENT literature. And let's say it's a bilateral, and you go concha bullosa. Well, I don't know what that is, but I saw a hole in one of the turbinates. Yeah, I think it was the middle. So you click on concha bullosa, and it shows you precisely what it is. In the bottom image, you can see two radiolucent areas within the middle turbinates, one larger than the other. The one on the patient's right side is large. We call this a bulbous variant, and it has actually, deviated the nasal septum towards the left. So you go, oh yeah, okay, nasal septum was deviated, oh, it was to the left, and the turbinates was bilateral. So the reason for the deviation is probably this anomaly of the concha bullosa in the patient's right middle turbinate. If we go to the airway section, you can see that there are several statements again. If there were a lesion, you could actually describe it. If you click on the box and then you say, well, that's not correct, if you unclick the box, it'll go away. If they had tonsillolus, and if you don't know what those are, well, let's say you didn't know what it was, so you click on the word tonsillolus, and these are the calcifications that occur in the oropharyngeal airway and can be a cause of malodor. So if you saw them clinically as tonsillar calcifications in the tonsillar crypts, fine, that confirms it. But if you just saw them on your scan, you could put those in as well. Cervical spine, same changes that happen in the temporomandibular joint condylar regions happen in the C-spine, and most cone beam machines 8x8 or larger will capture significant portions of the cervical spine, so you have to look there. And you'll see the same thing, subchondral cysts, some osteophytes. If you forgot what an osteophyte is, you can check the pop-up. Loose bodies. Loose bodies don't just occur in the temporomandibular joint space. They also occur very frequently in what's called the atlantoaxial junction. And Atlanta, is the second cervical, or axial is the second cervical vertebrae. Atlas is the first. And if it were a loose body between the two, you would see it on a thin grayscale sort of image. And then if you made a 3D, you'd see that this could be a problem. And those are seen frequently in arthritis, but on a rare occasion they can refer pain to the mid-face. So let's say there's a loose body in the atlantoaxial junction, and you might want to send that person to an orthopedic surgeon, so we might make that recommendation afterwards. And as you scroll through your volume, you'll see, maybe let's just say there's no significant findings in the left or right condyle. I've got left and right and then both. So, if they're interpreted as normal, you could put a normal statement in. That tells people that you've actually looked at it as well, that region. Dental findings, several missing teeth. Impacted teeth, if you click on the box, okay, teeth number are impacted, let's say teeth 17 and 32 are impacted. When you put that in, you'll see them at the bottom, and let's say they're in contact with the inferior alveolar nerve. You could click, and let's say one is and one isn't. Let's put number 17 is in contact with the nerve, and if you think that's an important statement, you could click the highlighted portion, and you'll see it'll come out highlighted on the report when we get there. Tori are very common, so let's say there are small mandibular tori. Periodontal changes, mild to moderate, moderate to advanced. We'll put down mild to moderate in this particular case. Endodontically treated teeth, tooth or teeth. So if you had a couple teeth that had endodontics, let's say, number 3 and 14. Fat fingered that one. 3 and 14 have had RCT. You can see it down in the bottom. And if it has or had, if you didn't like that, you could change the statement. Just double click on it and do it accordingly. I'm going to take out tooth because it's 2 and they have had. So basically you've got a nice statement about these teeth. Take that hashtag out there, or that slant. Okay. Finally, we get to endodontics. Let's say there's periapical lesion, a residual one on teeth. Okay, well, it's not teeth, so I'm going to get that one out of there. Let's say it's on tooth number 3. You say, okay, they've had root canal, and then that one still has a lesion. Other findings, let's just look at some of the pop-ups. The falx cerebri is a calcification in the midline. The only time it's significant is if you have it with skin lesions, and bifid rib with the Gorlin-Goltz syndrome. But you see them commonly. Falx cerebri are common without being in a syndrome. Paracellar regions, calcifications of the carotid arteries. It'll show you that, and if you go back through the webinars, if some of you decide to take them, I did non-COVID, scratch my nose there. In any event, if you see this in your scan, you may want to go back and check your patient's history for diabetes, but we'll be doing more of that in the seminar series. And let's say that they do have soft tissue calcifications consistent with MAC, and you didn't know what that was. Well, there they are. You can see in these axial planes of section, they look kind of circumferential or round. Again, you have to do the content to understand what you're looking at. But if you saw these and you weren't sure, you could send them for referral. If you saw them and thought they were similar to this particular problem, then you could put that statement down. So let's put it there, and that's going to prompt us to make a recommendation. And the recommendation is going to be interesting because this particular patient had them bilaterally, and if you look, you'll see the patient should be referred to the primary care provider for hypertension and stroke risk. That would be a single sort of calcification, but here they're bilateral, and they could be related because of the pop-up to diabetes or dysglycemia and or renal problems, which go hand in hand. So that's an important referral. Let's highlight that. We are now ready, because we've got the patient's information populated here, to create the report. So what we're going to do, as long as this is filled in and you know that the patient has been looked at and all the things populated that you found in your images, you can create the report. We're going to put this report on our desktop. I'm going to call it Ms. I don't know, sorry. Ms. I don't know. So when I say save, it'll compile this report. You'll see, I'll bring it up big here. You'll see that my logo is here for now because it's, my software. Okay, yours would be there. EasyRiter would be over here to the side. Patient's name, female, reason for the scan, her age, the referring doctor, it's all there. And then all of the findings that you clicked are in the report, very concise and nice. And the things that you want to stand out, like the nerve in contact with 217, and also the patient possibly, at risk for hypertension and stroke, as well as diabetes and renal problems, it will come out there. It's automatically dated. There's your signature. There's a place for some images on the next page, and then if you scroll down to the bottom of the report, you'll see my implant practice, Dr. Smith, cosmetic and implant dentistry, 1234 Elm Street. I didn't finish the actual company name there. So that's how you use EasyRiter. I'm going to close that now. Let me just close EasyRiter itself. And I'll bring me back up again, you lucky guys. If you have any questions, please contact me. You can go to www.easywriter.com to look at the software. You can also go to www.ondemand3d.com, where you can see it as a tool that's embedded in the on-demand software. They have trials of these software from their site, so you could actually download it and try it for 30 days and see if you like it. Also, if you want to contact me, if you own EasyRiter, and give me some feedback, tell me how it's working, how you like it, that would be great. If you have a need for reporting services, you can always contact me. Same email address, miles.dale@gmail.com. I'm still doing reporting, although those have slowed down because of this pandemic. But we will be back and up and running, and everybody moving ahead with their practices and seeing their patients. Hope you enjoyed this seminar. If you like EasyRiter, go out and find it. Thanks a lot. Have a great day.